right, if you could think of maybe one or two questions you'd like to ask. Raise your hand if you need a card. We'll get the cards to you. If you could put your name on it again so that Dr. Friedman and Mr. Tucker can respond to you, that would be great. First question is from Jay Langfelder. Where does the HIPAA law come into play if the federal government can pull your medical information from the central database without your permission?
This is actually one of my favorite stories in Obamacare. I recently wrote an article on American Thinker talking about, and it's americanthinker.com, called The Death of Medical Privacy. There are a number of sections of the Patient Protection and Affordable Care Act, as well as the stimulus law as it relates to health care records, that allows the federal government, without your permission, without your doctor's permission, to data mine information from your charts. Data mine it, collate it, analyze it, and publish not only the analyses, but the raw data itself, and provide it even to international organizations. There is a fascinating reference in some of these sections to HIPAA. And when I wrote the article, I actually didn't talk about this because I left it sort of as an Easter egg, where you could, if you felt like looking it up yourself, you could find the punchline to the joke. They do reference HIPAA and says, you know, the federal government has to conform with certain elements of HIPAA law when it collects and utilizes this information, and it references a section in the HIPAA law. And if you look up that section on the internet, you'll find that that section says that the government gets to write its own rules about what parts of HIPAA that it follows or not. So HIPAA, as it applies to the Patient Protection and Affordable Care Act, the federal government basically says they can do whatever they want with your information, write whatever rules they like. So there never was any HIPAA protection for you and your charts and your information from the government. But the paper chart sitting in somebody's office, how do they get that? I mean, think about the massive undertaking of collecting your data when you've got 300 million people with paper charts or individual electronic medical records that they don't have access to. We can send out to get that stuff. Now, as things are developing over the next few years, all that data is going to already be stored electronically with the vets, and then it becomes an easy thing.
Dr. Friedman, how do you foresee the role of a nurse practitioner in the new healthcare reform? And that's from Molly. Molly, raise your hand.
Hi, Molly. I've thought this through a little bit. You know, there's probably in the end going to be kind of a couple of tiers of nurse practitioners, or we call them physician extenders. You know, one of the things that we've learned in medical research is that physicians, or anybody who provides care, gets pretty good with experience. By the way, that's one of the things this whole healthcare law seems to move us away from, which is that a lot of the instinctual decisions that an experienced provider makes are based upon things they can't really put their finger on, but are leaping over several potentially expensive, dangerous, painful steps to get you to the end. And it happens all the time. But what we have in place now are a fairly moderate number of nurse practitioners, physician assistants who are really highly qualified at what they do. But we're going to need a heck of a lot more people to start administering Obamacare. Nurse practitioners, physician assistants, and this kind of new creation called medical home managers, which is basically somebody whose only job is going to be to see you and decide whether or not you get through the gate at your new accountable care organization, HMO model. The problem is none of these people are going to be the people we're using now. So the woman who's been, my cousin who's been a nurse practitioner for 16 years in pediatrics, she's not going to be the person you're going to see. She's already got a job. All of these new people are going to be brand new productions of these new education systems that show up in Obamacare. It's a little bit worse than that, in my opinion. It seems like I'm the downer today. I don't have anything positive to say. One thing I didn't talk about when we talk about these guidelines are going to be set in concrete in your doctor's office, or your nurse practitioner's office. And that's actually important. You know, they're going to get rid of doctors, largely. 46% of us are claiming we're going to leave medicine. We're increasing the number of people who are coming into the system by many tens of millions. And